Days after Uganda enacted one of the most draconian anti-gay laws on earth, the usual daily influx of patients has all but dried up at this HIV/AIDS facility in Kampala. Around 50 patients used to drop in every day. Now, only 2 or 3 have been showing up, according to staff. One of them is a transgender woman who cannot be named for safety reasons.
This clinic is an LGBT clinic. You can come, express yourself to the doctors. You feel like you can say anything.
Since the legislation was signed, US President Joe Biden directed the National Security Council to evaluate the implications for US engagement with Uganda, including PEPFAR, the US President's Emergency Plan for AIDS Relief. PEPFAR estimates its support for the scale-up of antiretroviral treatments in Uganda helped avert nearly 600,000 HIV infections between 2004 and 2022. Reports of possible cuts have unnerved the program's beneficiaries and transgender patients.
I feared because I was thought that yes, the bill was there, it has passed. We are not going to get the treatment we have been getting. The organization they are not going to operate. We are going to be like indoors. You can't access even lubricants.
The US-funded facility was, until recently, a prime example of the country's success in the fight against HIV. A clinician working at the facility, who also cannot be named for safety reasons, warns that new waves of infection could be forming, as members of the LGBT community are now afraid to access life-saving medicines.
You find out that, one, the infections, the surge of infection is increasing because people are not protecting themselves. Centers like DICs, the queer DICs, where queers just come and pick some preventive medications and other services, are being blocked from continuing to serve. It means prevention of HIV has also been cut.
In Uganda, 1.4 million people live with the virus and 17,000 die a year as a result of its ravages, according to the state-run Uganda AIDS Commission. Under the bill, which President Yoweri Museveni signed into last week, gay sex is punishable by life in prison, while aggravated homosexuality, which includes transmitting HIV, is punishable by death. Uganda's health minister said last week that the government would ensure that prevention programs would remain accessible to those that needed them. The health ministry declined to comment for this story.